One of the questions that men ask, or want to ask, and may be afraid to, is if I have external beam radiation, will I be radioactive, and will it be dangerous for me to be around my grandchildren or my other loved ones? The answer to that is no. You are not radioactive when the external beam radiation machine, called a linear accelerator, is turned off. The second thing that they will worry about is that they will be nauseated, because people think that everything I do makes people throw up. And external beam radiation therapy to the prostate area very, very rarely causes nausea. So that's a question men often have: will I get nauseated? The third thing that people always want to know is, will I smell smoke? So people think that radiation somehow is burning, and sometimes that's because, you know, a urologist might have even implied that, or it's maybe somebody who was trying to be helpful said, oh, my cousin had that, and, you know, maybe gave inaccurate information. So basically I always have to point out to people, even if they don't ask, no, this is not burning, you will not smoke, you will not smell like barbecue. So I always make sure people know that. The fourth thing that people ask me about external beam radiation is, should I travel elsewhere to have it? And one of the questions that they're really asking there really is, should I have protons? Because now there is tons of advertising in the United States. Go and come and have protons in my hospital in the U.S. It's a big moneymaker there, and it's been on news magazines and everything. And men are prepared to mortgage their houses and do all sorts of things to go have protons if they think it's better. The answer is, for prostate cancer, it is not. The reason it is advertised, you can imagine, because it's the United States of America and it's private healthcare. But also, to be honest, protons are useful for some other things, but the other things are uncommon, so we have to treat more common things to make the machine fiscally viable. And so a common thing is prostate cancer, so just about any proton center will treat a lot of prostate cancer patients, and they would love Vancouver patients or patients from elsewhere in British Columbia to go down and spend between $50,000 and $70,000. I don't think you would love it. So the last thing is external beam radiation a bad treatment? I hear there are lots of other better things, and by that I don't mean protons so much anymore. People will often be told or have read somewhere that surgery is better, and sometimes that may be true depending on the risk group your cancer is in, but it may not necessarily be true. But the other comparison people sometimes make, and we'll talk, there are questions about that separately, they'll say that it's a bad treatment relative to brachytherapy. It's not. It's certainly, there are occasions where we'll think brachytherapy would be better than external beam radiation, but it is worth bearing in mind that today in British Columbia and in many places, the number one treatment for prostate cancer that's given is still external beam radiation therapy, which will tell you something. It's still a good treatment, and it's still a good treatment partly because we're better able to do it with the improvements in computers and treatment machines and everything like that.